Hey Staten Island, this is HealthWish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone.
Today, from Violette, Cellar, HealthWish joins Staten Island University Hospital's Director of Otolaryngology, Dr. David Hiltzik. We asked Dr. Hiltzik what it's like to run one of the island's busiest medical practices. Give a listen.
Hello, and welcome, Dr. Hiltzik.
Yeah, thank you guys for taking out the time, and it's really a pleasure to hang out and talk a little bit about what we're doing here and the exciting things we're doing out in Staten Island with regard to ear, nose, and throat care.
What days are you typically in? You got your Tuesdays in the OR?
Yeah, so Tuesdays and every other Monday, and the rest of the days I'm in clinic. So, and then on Fridays I'm in Manhattan at Lenox Hill.
What's office like? Because or office life like? Because I know we speak a lot about surgery, but what are you doing typically when you're just in the office? You catching up on emails or some other administrative stuff?
So there's being in the office, and then there's two parts. There's like the administrative work I have as the director, but then most of it's focused clinically based, which is really just seeing patients, which I would say is more intense for me than being in the operating room.
I know the last time I was in your office, you actually removed parts of my throat. So I guess it can be a little intense when you have to make those decisions on the fly.
So those are all procedures of patients who are completely awake. So the operating room is a very controlled environment, right, where the patient's asleep. You have all the correct instrumentation. You have a lot of assistants around you. Because as the surgeon in the operating room, pretty much everyone is there for you, right? So you have the patient, you have the medical student, you have the resident, you have the rotation staff, the OR tech, the anesthesiologist are there for me. So there's a lot of attention and a lot of assistance. When you're in the office, it's the personnel is much smaller. The pace, particularly in my practice, is much faster. And you have awake patients that you have to interact with on a real life basis in dealing with obviously uncomfortable circumstances. Nobody comes in saying, "Doc, I'm great today. I just came to
hang out."
Occasionally I will get that, but that's obviously few and far between. But the main objective there is to solve people's problems, and they're coming to you with their problems. So that can range, from things that are not very serious to things that are life and death. So you have to not only be on your game technically, because we do have a lot of procedures that we do in the office, but then obviously from medically you have to be on target, and you also have to be from a humanistic standpoint, being very connected to the patient you're talking to. So and you're doing that in intervals that only get shorter and shorter as I've gone through my career and experiences that volumes increase, and there are a lot of patients on Staten Island who need care, so that becomes a pretty intense experience.
It's like, as you're explaining it, what I'm picturing in my head is like improv versus scripted, right? So like, as you have patients walking through the door, you don't know what to expect, and you need to sort of respond with all of the wisdom and education that you received up until that point. Whereas with surgery, you can come prepared. You have a little bit more of a controlled outcome.
Healthcare is sometimes very scary. How do you deal with addressing some of those fears and kind of making people a little bit more comfortable and calming them down? And what's that like?
Right. So I think to address your point, that's a fantastic analogy, which I will incorporate.
Yeah, you could certainly take that.
Yeah, I'm going to take that with you. Yeah. I'll quote you.
That's fine. Every time.
But that's a great point. So just to sort of bring the 2 points together is that you never know what room you're walking into. So when you knock on the door, you have no idea there's someone there, but there's also a whole life story and a whole set of circumstances of which you have to get a sense of, because you're obviously not going to fully understand that within moments. So, over the years, you learn to go in without no presuppositions. It's like every patient and some of it becomes instinctual at a certain point, but you just have to go with your sense of the person, what they're dressed like, which family members are in the room. Like you have to do a whole immediate assessment within seconds as to how you want to interact. And to your point, then based on a lot of that sort of like both visual and, we do ear, nose, and throat. So even, auditory input and even olfactory input, like you have to adjust your whole approach to things. So, the nature of the problems obviously dictate kind of where you're at with things. So like we do a lot of quality of life issues. Those are a little less intense. But then we also deal with a lot of, life and death, cancer issues, which are obviously of the utmost importance. But then you're also dealing with loss of special senses. So when you have people who come in who dramatically have lost their hearing or dramatically have lost their smell and taste, or a teacher who comes in and loses their voice, it's pretty intense. So the first thing sort of I've learned to do is listen, because you need to get, like the improv point is, you need to gather as much input as you can, and really and listen to the whole person, taking that all in. And I think once you get a sense of the person, then you can also then start to gauge how you're going to respond to them. Some people real blunt, just give it to me, doc, right. And other people who are a little more sensitive, you have to take a little bit of a different approach. That. So it's really, you're right. So it's really, trying to get a sense of the person and the patient and the disease all at the same time. And I think that's sort of like, I would say, my approach towards that in a nutshell.
You deal with very serious issues, but ear, nose, and throat, I'm sure you get a lot of kids that, stick things in their nose or their ears. Are there ever times you just kind of laugh to yourself? Like,
well, no. If I can, it's best if you can laugh out loud, because if you give a sense, laughter's good medicine, as they say. So if you have, the patients or in those cases the parents who have a sense of humor about it, then yes, that really can lighten up the mood quite a bit if you can if they can handle it. Which is, again, getting a sense of what you're doing with. Some people take it very seriously. I mean, hey, their kid just jammed something in their ear. Did they hurt their eardrum? Did they lose their hearing? So you have to, again, sort of get us in. But if you can incorporate a little bit of, mellowness, particularly with the kids, I like to see what age they're at. And I thankfully have children of my own, so I am a little in on the scene there where I can relate to them. So I've been known to play certain unicorn songs while we're with the kids, or
some Peppa Pig or something.
No, they're not into that as much anymore. but princesses and these such things. But if you can get that going, then it relaxes everybody.
What are some funny things you saw?
You can go from the extreme of, like, let's say an ex-con who just came out of jail with like maggots in their ear. What? So that's pretty dramatic, to a diamond.
Oh, I would have liked
so
that.
It goes from through extremes. But normally it's erasers, beads, Q-tips. Right. Those are kind of the main. I've had a Lego piece, but then also kids swallow things too. So that's where you get, and that's more in the hospital, but that's where you get a lot of coins. I had a great X-ray where it was a star amulet. And so we had the X-ray, and there was a face and a big star right in the throat area. So we had to extract that under anesthesia.
What are some things that you do, just kind of take a break, unwind, de-stress?
You don't. No. During office hours, it's just that's what I'm saying. In comparison to the operating room, that's one type of focus. I like to play music in the operating room, so that helps me a lot, sort of in that space.
What kind of music do you like to listen to?
It can really range. So I can go from, alternative 90s. So it's basically, I do Pandora stations. So I guess I can go from like Toad the Wet Sprocket to like Coldplay to Jack Johnson to Avicii. So those are some of I've done, I had a Grateful Dead point where I was playing it. But nobody really liked that except for very particular people. And it turned out actually one time I played it, and there was a deadhead who literally, she couldn't get enough of it. And then I have another nurse who's a Dave Matthews Band fanatic, so I put that one on for her. But I take requests. I've had to do that when patients go to sleep. Then the hard hip hop is a little not exactly calming as you go under anesthesia, but listen, what's what the patient wants. If that works for them, then it's totally fine. But those are the ones that I'll kind of float between.
Right.
I think that's a good question going forward. Like, music and the OR and then the office, because everyone has their tastes. Music to me has always been one of those things where it like kind of shines a light on like the inner workings of a person. So. And it's good to know that you like some of the music that I do. I do enjoy.
Now, are you in the OR like jamming out?
No. So I'd say like there is closing music. So then when you're done with the kind of intense part of the case, and you can like sort of lay back a little bit as you're kind of putting things back together. But we've known, like for example, I think I had a couple ones. So. When I think I was listening to Cat Stevens station, and something came on, and literally the whole operating room just started singing together. So that was kind of an interesting experience. That doesn't happen often, but it did. But for the most part, people are it's more just for me. I concentrate better, and I always have since I've been younger. So it kind of works for me. But you can't do that in the office.
No, it's interesting. I feel like a lot of surgeons have some sort of music playing while they're operating, and it's just interesting to think about what's going on in their head while they have somebody wide open on a table.
Right.
But
what's happening is you're focusing on what you're doing.
Right.
And some people I think work. So there are other surgeons who work better with silence, and that's the way they focus better. For me, to have that kind of auditory input helps relax my mind on other things, and helps me focus on what's right in front of me. Yeah,
it's kind of like when you're studying, just putting some relaxing music on.
That's where it all starts. Listen, we're all pre-med, so how many hours have I spent studying? And I would play music while I was doing all my studying.
And I'm sure that's compounding too. So like years of getting used to that and knowing what helps you get in the zone, knowing what wakes you up. For me, music has always been like when I'm in the mood for it versus when I'm not. There have been times where I needed to concentrate, and I'll throw on some music in the background, and I have a hard time thinking, so I'll know, what, that's not what I need. But for pre-med and surge, I'm sure you've built a very close relationship with music.
No, and the other thing which I very much enjoy, my favorite things to do is to go to live concerts. So that is, if you want to like outside of work, that's very important.
Who's some of your favorite people to go see? I heard the Grateful Dead are great.
I did Dead and Company a few years ago. No, I do. I think every tour I'll see U2. I've seen every tour of theirs, since I've been in, the past 20 years. Coldplay. So those are like more generic, but Imagine Dragons, I go with my son. That was phenomenal. Lumineers I did recently. Jack Johnson. Again, a lot of the people I listen to. Okay. Yeah, I went to that one in Barclays.
So
that was my last concert I went to before COVID.
Oh, okay. Yeah. Wow.
Yeah.
Yeah, they're a Brooklyn-based band too.
Yeah.
Oh, really?
Or Vampire Weekend.
Okay, yeah.
So that's another New York centric. There are a bunch of guys from Columbia, but concerts are amazing.
See, for me, music it helps me get into the mood of whatever I'm doing.
Right. Because in the operating room, it's what my mood of the day is. Because the setting's the same.
So if I'm being operated on by you, and as I'm fading out, grindcore is blasting in the background.
Yeah, right.
I'm like, oh no. Oh no.
Yeah, exactly. Maybe more like Enya.
Enya?
We'll
okay. All right.
Go with Enya, maybe.
Next time, we'll ask Dr. Hiltzik about the things he enjoys most when not wearing a stethoscope. HealthWish wishes to thank our very special guest, Dr. David Hiltzik, Director of Otolaryngology at Staten Island University Hospital. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.